This week, we will talk about the endocrine and reproductive systems. The endocrine system is a system of glands that secrete hormones. The structures of the endocrine system. The endocrine glands are ductless or tubeless organs that secrete hormones. The hormones are chemical substances that are produced in glands and help regulate many body functions. The thyroid gland produces hormones that regulate metabolism, body heat, and bone growth. Parathyroid glands produce a hormone that regulates body calcium and phosphorus balance. The pancreas is a gland that serves both digestive and endocrine systems. Pituitary gland regulates and controls the activities of all the other endocrine glands, called the master gland. The gonads is another name for the ovaries and testes. The adrenal glands are glands that help the body recover from stress and respond to emergencies. Some of the problems of the endocrine system is diabetes mellitus. Is a disorder where the pancreas produces too little or no insulin, resulting in high glucose levels. Graves' disease is another disorder in which an overactive and enlarged thyroid gland produces excessive amounts of thyroxine. Cushing's disease is the overproduction of adrenal hormones. A goiter is an enlargement of the thyroid gland. This is mainly caused by a lack of iodine in the diet. And as you can see, this is your thyroids to the left, in the left picture. And then diabetes can affect when you have too little or no insulin, resulting in high glucose levels. And that's the picture on the right. Okay, the structure and function of the male reproductive system. Reproductive system is the system of organs involved in producing offspring. Sperm is the male reproductive cells. The male sex hormone is testosterone. Two small glands that produce sperm are called the testes. The testes are located in an external skin sac called the scrotum. The penis is the tube-shaped organ that extends from the trunk of the body just above the testes. The thick fluid that contains sperm and other secretions from the male reproductive system is called the semen. The internal male reproductive organs. The seminal vesicles produces a nourishing fluid that combines with the sperm as they move through the vas deferens. Urethra is the passageway through which both semen and the urine leave the body. The prostate glands and Cowper's glands are glands that produce secretions that combine with the sperm containing fluid to produce semen. For the care of the male reproductive system, you have to have regular checkups, and that should occur every 12 to 18 months and should be performed by a physician. Regular bathing or showering should happen daily for a thorough cleansing of the penis and the scrotum. Uncircumcised males should be sure to clean, take care, and wash under the foreskin. Wearing protective equipment like a cup or supporter during physical activities should shield external organs. STDs. You can get chlamydia and gonorrhea, which are bacterial infections that cause discharge from the penis and burning upon urination. Syphilis is another bacterial infection, is initially painless reddish sore that appears on the site of the infection. Genital herpes is a virus that causes periodically occurring blister-like sores in the genital area. The problems of the male reproductive system. An Inguinal hernia is a separation of tissue that allows part of the intestine to push into the abdominal wall near the top of the scrotum. Sterility is the inability to reproduce. In males, it can result from too few sperm, fewer than 20 million per millimeter of seminal fluid, or sperm of poor quality. Testicular cancer can affect males of any age, but occurs more often in males between the ages of 14 and 40. When the prostate gland can become enlarged as a result of an infection, a tumor, and age-related problems are known as problems of the prostate gland. The female reproductive system The female reproductive system has several functions. It produces female sex hormones and stores female reproductive cells called ova, singular ovum. The structure and function of the female reproductive system. The ovaries are the female sex glands that store the ova and produce female sex organs. The ovulation is the process of releasing a mature ovum into the fallopian tube each month. The female reproductive organs The fallopian tubes are a pair of tubes with finger-like projections that draw in the ovum. The vagina is a muscular, elastic passageway that extends from the uterus to the outside of the body. The menstruation the cervix is the opening to the uterus. The shedding of the uterine lining is called menstruation. This shedding of uterine occurs about every 28 days. The care of the female reproductive system is regular bathing. That's especially important during the menstrual period. The practicing of abstinence from sexual activity. It is the only 100% effective method in preventing pregnancy and STDs. Breast self-exam. It's important to detect breast cancer early. The best time to do this is right after the menstrual period. The problems of the female reproductive system is menstrual cramps sometimes occur at the beginning of a menstrual period. Premenstrual menstrual syndrome is a disorder caused by hormonal changes, and toxic shock syndrome is a rare but serious bacterial infection that affects the immune system, and the liver can be fatal. Problems to infertility. Endometriosis is a painful chronic disease that occurs when tissue that lines the uterus migrates and grows in the ovaries, fallopian tubes, uterus, or pelvic cavity. Pelvic inflammatory disease is an infection of the fallopian tubes, ovaries, and surrounding areas of the pelvis. Sexually transmitted diseases are the most common causes of infertility and other disorders of the reproductive system. Other female reproductive disorders is vaginitis. It's caused by bacterial vaginosis and is the most common vaginal infection in women of childbearing age, and is often accompanied by discharge, odor, pain, itching, and burning. Blocked fallopian tubes is the leading cause of infertility and may result from PID, abdominal surgery, STDs, or endometriosis. Ovarian cancer or ovarian cysts are fluid-filled sacs on the ovary. Then there's cervical, uterine, and ovarian cancer, which occur in the female reproductive system. This is the end of the Week 6 mini lecture.